At this age, your time is precious. So is your energy. You spend a lifetime doing your best, showing up to appointments, following doctor's advice, saying yes to every test that promised to keep you safe. But what if some of those tests no longer serve you? What if the same screenings that once helped you stay ahead of disease are now quietly draining your strength, your peace of mind, maybe even putting your body at risk? It's a hard truth, but an important one. After age 70, not all medical tests are created equal. Some might bring clarity. Others may only bring confusion, unnecessary treatments, and fear you didn't need to carry. In today's video, we'll gently walk you through 5 common health tests that many older adults are still told to do, yet may no longer be necessary. Or worse, may cause more harm than good. You'll hear real stories, expert guidance, and questions you can ask your own doctor. Because this isn't about avoiding care. It's about making care smarter, simpler, and better for the stage of life you're in now. Let's begin with compassion, clarity, and your well-being front and center. 1. Colonoscopies after 75, when the risks outweigh the rewards. Colonoscopies have long been considered a gold standard for preventing colon cancer, and rightly so. For adults between 50 and 75, the benefits of catching precancerous polyps early can be life-saving. But once you cross 75, especially if you've had clean results in the past, the equation begins to shift. Why? Because colon cancer typically develops over 10 to 15 years. If you had a normal colonoscopy in your 60s, your risk of developing aggressive colorectal cancer later in life is already low. Continuing to screen aggressively beyond 75 may not provide any new or useful information, but the procedure itself carries growing risks with age. As we age, the colon becomes more fragile. Sedation becomes riskier due to slower liver and kidney function. Bowel preparation, those harsh laxatives you must drink beforehand, can cause dangerous dehydration and electrolyte imbalances, especially in older adults with heart conditions or kidney issues. In fact, a 2018 study from the Journal of the American Medical Association, JAMA, found that hospitalization rates after colonoscopy were significantly higher in people over 75, including complications like bleeding, infection, and even strokes from anesthesia-related blood pressure drops. Let's also consider the emotional impact. Imagine going through all the discomfort and anxiety of the procedure, only to hear, "Everything looks great." That may sound like good news, and it is, but the odds were already low. Was it worth the stress? Instead, many geriatric specialists recommend switching to less invasive tools for continued monitoring. The FIT test, fecal immunochemical test, or Cologuard, a stool DNA test, can be done at home, pose no physical risk, and are highly effective in spotting signs of early disease, without the need for sedation or hospital prep. And remember, your overall health status matters. If you're 78, strong, and have 15 plus good years ahead, maybe another screening makes sense. But if you have multiple health conditions, have had normal past results, or feel vulnerable, then stepping back from aggressive screening could be the most responsible choice. Always ask, will this test change how I'm treated or only cause stress? That question alone may save you more than one sleepless night. 2. PSA tests after 70, the test that can cause more harm than help. For decades, the PSA, prostate-specific antigen, blood test was seen as a miracle tool, able to detect prostate cancer early and potentially save lives. It became almost routine, especially for men in their 50s and 60s. But over time, we've come to understand that when and how this test is used matters deeply, especially after the age of 70. Here's why. PSA levels naturally increase as men age. That means even men without cancer can show elevated levels, leading to false alarms. These false positives often trigger a cascade of follow-up procedures, such as MRIs, biopsies, or even surgery, that may not have been necessary at all. Now imagine this scenario. A 72-year-old man named George, retired, still gardening, enjoying life, has a routine checkup. His PSA is slightly elevated. His doctor recommends a biopsy. It's uncomfortable, but he agrees. The results show a small, slow-growing cancer. Because it's the word cancer, George panics. He agrees to radiation treatment. Afterward, he suffers from urinary incontinence and erectile dysfunction, both of which severely impact his confidence, his relationship, and his day-to-day joy. Here's the truth. Most prostate cancers in older men are so slow-growing, they'll never cause symptoms or affect lifespan. The American Cancer Society and the U.S. Preventive Services Task Force both now recommend that routine PSA screening should not be done in men over 70, unless there's a very high genetic risk or other compelling reason. In fact, the U.S. Veterans Affairs, VA, healthcare system published data showing that PSA screening in elderly men increased anxiety, unnecessary procedures, and side effects, but didn't increase overall survival rates. Let's look at the risks from another angle. The biopsy itself, though outpatient, involves inserting needles into the prostate to extract tissue samples. In older men, this can cause bleeding, infection, or hospitalization. Treatments like surgery or radiation may extend life by only a few months or not at all, yet cause permanent side effects. So what should you do? If you're over 70 and your PSA has always been low, there's usually no need to continue testing. If it suddenly rises but you have no symptoms, like pain, urinary issues, or unexplained weight loss, your doctor may suggest watchful waiting instead of aggressive action. Watchful waiting, or active surveillance, means monitoring your PSA over time to see if anything changes significantly. It's a safe, science-backed approach that avoids unnecessary harm while keeping an eye on your health. And if you're still unsure, don't hesitate to get a second opinion from a geriatric oncologist, someone who specializes in cancer care for older adults. Because the goal isn't just longer life, it's better life. Quality of life matters more than chasing numbers on a test that might not mean what you think. 3. Mammograms beyond 75, when early detection may go too far. For many women, the annual mammogram is almost a sacred ritual. It represents vigilance, strength, and taking charge of one's health. And for good reason. In earlier decades, routine mammograms helped reduce breast cancer deaths through early detection and timely treatment. But once a woman passes age 75, the situation becomes far less clear-cut. Let's take Margaret, 79, from Oregon. She was active, sharp, and living independently. She had always gotten her annual mammogram without question. One year, a screening detected a 0.8 centimeters lump. Her doctors acted quickly. Lumpectomy, radiation, follow-ups. The treatments exhausted her. Her skin burned. Her sleep vanished. Her energy dropped dramatically. And in the end, the pathology showed that the cancer was so indolent, so slow-growing, it likely would never have caused her harm. This isn't rare. Multiple large-scale studies have found that for women over 75, routine mammograms often detect overdiagnosed cancers. Those that, while technically cancerous, are so slow to grow that they never would have caused pain, disability, or death. In fact, a 2020 study published in JAMA Internal Medicine showed that older women who continued yearly mammograms had no significant reduction in mortality, but did experience higher rates of false positives, unnecessary biopsies, anxiety, and overtreatment. Here's the key. The older we get, the more important it becomes to weigh the benefits of screening against its potential harm. Mammograms aren't harmless. They involve radiation exposure, albeit small, plus the risk of anxiety from false positives, invasive biopsies, and surgeries that might impact an older woman's quality of life, not necessarily length of life. This is especially true for women with other serious health conditions, like heart disease, diabetes, or cognitive decline, where cancer treatment might be more dangerous than the disease itself. So what should you do? If you're a healthy 76-year-old woman with no major health issues and a strong family history of breast cancer, a conversation with your doctor about continuing mammograms might make sense. But if you're 80 with multiple chronic conditions and no new symptoms, you might choose to stop, and that's okay. Stopping doesn't mean you're giving up. It means you're making a wise, individualized choice based on your needs, not outdated medical checklists. Instead of automatic annual screenings, talk with your provider about risk-based screening, a personalized approach based on your health, preferences, and values. Because ultimately, aging well isn't about doing everything. It's about doing what matters most. 4. Bone density tests after 70. Why more isn't always better. Osteoporosis is a real concern as we age. Weakening bones, increased risk of falls, and fear of hip fractures are all valid issues, especially for women after menopause. That's why bone density scans, or DEXA scans, became a popular way to measure fracture risk and guide treatment. But here's what most people over 70 don't hear. Repeating DEXA scans too frequently or without clear purpose can cause more confusion than clarity. Let's meet Ellen, 74, from Manchester. She was diagnosed with mild osteoporosis in her late 60s. She began taking bisphosphonates, followed a calcium-rich diet, and did her daily walks with ankle weights. At her follow-up appointment, her doctor ordered another DEXA scan just to check progress. The result? A slight dip in her T-score. This led to a switch to a stronger medication, which caused joint pain, stomach upset, and fatigue. The new drug disrupted her daily life and left her wondering, was the test result really worth all this? Here's the nuance most patients aren't told. Bone density doesn't change rapidly. It takes years, not months, for meaningful shifts to occur. Medications like bisphosphonates work slowly, and benefits are seen over 5 to 10 years. A small dip in T-score doesn't always mean increased fracture risk, especially if the person hasn't had any falls or symptoms. Furthermore, bone scans alone don't tell the full story. They don't assess balance, muscle strength, fall risk, vitamin D levels, lifestyle factors like physical activity and smoking. That's why many geriatricians now say, treat the person, not just a scan. A better question than what's my T-score is, have I fallen the past year? Do I feel steady when walking or getting up from a chair? Fall risk is the single most important predictor of bone fracture, not the DEXA score. In addition, some experts worry that over-reliance on repeat scans leads to unnecessary medication switches or overtreatment in older adults. Drugs like Forteo or Prolia may be helpful, but they also come with side effects and require careful monitoring. For seniors with mild osteoporosis and no fracture history, lifestyle interventions may be just as effective with fewer risks. So what should you do? If you're over 70 and have never had a DEXA scan, it's reasonable to do one, especially if you've lost height, broken a bone, or are postmenopausal. If you've already been diagnosed and are on treatment, you may not need another scan for 2 to 5 years, unless your doctor believes it will change your care. If you're not on medication and your risk is low, focus on what really protects your bones. O, daily weight-bearing exercise. O, balance training, like Tai Chi or yoga. O, vitamin D and calcium. O, fall-proofing your home. And most of all, talk to your doctor. Ask, will this test change what we do next, or is it just a habit? Because the strongest protection isn't always a scan. It's knowledge, movement, and mindful care. 5. Full-body CT scans, the illusion of safety. Imagine this ad. Come in for a 1-hour full-body scan. Detect cancer, heart disease, stroke risks before they start. Sounds amazing, right? Especially if you're over 70 and want to stay ahead of your health. But here's the hard truth. Full-body CT scans, often marketed as executive physicals or premium health packages, can create more fear than facts. And for older adults, the emotional and physical toll may outweigh any theoretical benefit. Let's take Robert, 76, from Sydney. He was in good health, retired, and enjoying golf twice a week. He saw an ad offering a total health scan, chest, abdomen, pelvis, brain, all in one session. The scan revealed a 3 millimeters spot on his lung. The radiologist called it probably benign, but couldn't rule out early cancer. This kicked off a chain reaction. A second scan, a biopsy, a collapsed lung, a 3-day hospital stay. The final result? It was scar tissue from an old infection he had in his 40s. No treatment was needed, but the anxiety, pain, and complications were all very real. This is the hidden danger of these scans. Incidentalomas, incidental findings. Small spots, cysts, or nodules that look suspicious, but almost always turn out to be harmless. Yet, once they're discovered, they demand attention. And that attention comes in the form of invasive testing, emotional distress, and potential harm. Let's also talk radiation. A full-body CT scan exposes your body to a significant dose of ionizing radiation, equivalent to hundreds of chest X-rays. While one scan is unlikely to cause harm, repeated scans over time can increase your lifetime cancer risk, especially in those already more vulnerable. Most major health organizations, including the American College of Radiology and U.S. Preventive Services Task Force, do not recommend routine full-body CT scans for asymptomatic people. Why? Because they haven't been shown to improve survival, and they lead to overdiagnosis, overtreatment, and unnecessary worry. Now, this doesn't mean imaging has no place in aging care. Far from it. CTs, MRIs, and ultrasounds are powerful tools. When there's a reason. If you have symptoms like unexplained weight loss, bleeding, or persistent pain, your doctor may recommend specific imaging based on clinical signs, not a one-size-fits-all scan. So what should you do? If you're offered one of these comprehensive packages, pause and ask, what happens if they find something small? Will this test actually improve my quality of life, or just create new problems? Would my doctor recommend this, or is this just a sales pitch? A far better approach to preventive care over 70 is personalized, symptom-guided, evidence-based medicine. That means staying current on vaccines, managing chronic conditions with your doctor, staying active mentally and physically, regular check-ins, not aggressive testing. Remember, a clear skin doesn't guarantee peace of mind, and a blurry shadow doesn't always mean danger. What matters most isn't scanning every inch of your body. It's living every day with clarity, comfort, and trust in a care plan tailored just for you. Expanded conclusion. Speak to the heart. Let's pause here for a moment. If you've made it this far, chances are you care deeply about your health or the health of someone you love. And that matters. Because in a world that often tells us to do more, to screen everything, to stay ahead at all costs, it takes true wisdom to step back and ask, is this helping me? Or just making me more afraid? After 70, the goal of medicine isn't just early detection. It's peace of mind. It's preserving independence. It's feeling strong enough to play with your grandkids, take long walks, or enjoy your morning coffee without worry. None of that comes from chasing every tiny abnormality. It comes from smart, mindful, respectful care. These 5 tests we talked about today aren't inherently bad. In fact, they've saved lives when used at the right time for the right person. But the danger comes when they're used out of habit, fear, or pressure without asking, what's right for me right now? So I want to leave you with this. Backhand index pointing right. If a test won't improve how you feel, backhand index pointing right. If it won't change how your doctor treats you, backhand index pointing right. If it may cause more stress than clarity, then maybe, just maybe you don't need it. Talk to your doctor. Don't be afraid to ask hard questions. And most importantly, trust your body and your wisdom. You've lived through more than most. You've earned the right to make careful, informed choices about what's worth your time, your energy, and your peace. Speech balloon now. I'd love to hear from you. Have you ever had a medical test you later wished you hadn't? Or maybe a test you bravely chose to skip, and it turned out to be the right call? Share your story in the comments. You never know who might read it and feel a little less alone, a little more confident, and a lot more hopeful. And if you found this video helpful, please click like, subscribe, and share it with someone over 70 who's navigating the same healthcare maze. They deserve clarity, not confusion. Empowerment, not fear. We're here to help make aging not just safe, but meaningful, strong, and joy-filled. Because growing older should never mean growing powerless. Thank you for watching and for taking control of your care with compassion and courage. We'll see you in the next video.